Being a parent in the NICU can be difficult. The NICU team will try to make you feel comfortable and involve you in your baby's care. Remember, you are welcome in the NICU at any time, day or night. We encourage you to spend as much time with your baby as you can. Siblings are welcome to visit. You may bring other family and friends into the unit to see your baby as long as they are healthy. There is a maximum of 3 visitors at the bedside at one time.
Probably the most positive experience being in the NICU is having the kids be allowed to come in and hold him. Like, I definitely see with both of them, with Andrew and Paige, that they love coming here to hold Jared, even if it's only for a couple minutes. It really, it makes them happy, and they're always asking to hold him, so I feel like it is a way for them to connect with him without him being at home. Also, I guess it's in the same, but letting our parents be here as much as they can, even if I'm not here. So having the list of people that can come without me being here, just knowing that if I'm not here, somebody else might be here, either just talking to Jared or holding him, and that is important to me.
The team will keep you updated on any changes that happen with your baby during the NICU stay. If your baby is sick, you may not be able to hold your baby in your arms right away. Easy ways of holding and being close to your baby will be explained to you by the NICU team. Placing your hands on your baby and holding gentle, steady pressure is one example. Once your baby is more stable, the NICU team will teach you how to do skin-to-skin care, also known as kangaroo care. During kangaroo care, your baby will be placed on your bare skin. This allows your skin heat to keep your baby's temperature normal. It allows the baby to bond with you in a way that is safe and least disturbing. We ask that you plan to spend at least 1 hour with your baby for skin to skin.
Some words of advice I would have to give to new moms or moms and dads coming into the NICU would be to be here and be involved in the care, ask a lot of questions. There's a lot of acronyms being used all the time. Everyone's very welcoming and explain everything very thoroughly. Also would be to get involved in the care, be hands-on as much as you can. It's your baby, you're here for them. They are very familiar with your voices and even just your smell. And I think being here, I've seen my son thrive even in the last few weeks.
As a parent, the NICU experience is a bit of a roller coaster with its ups and downs. Your baby will have good days, but they may also have setbacks and bad days. In the early days or weeks, it is common for us parents to have many challenging emotions, including feelings of loss, sadness, fear, and even anger. Many parents continue to feel distant from their baby. It's hard to feel like real parents in this highly medical environment. Some things that parents have found that have helped include personalizing your baby's bed space. This can be done by bringing in a few personal belongings such as pictures of you and your family and a special stuffy. There are whiteboards at each bed space where you, the parent, can write messages to the staff or to your baby. These tools are available at both the Royal Alex and the David Schiff sites. Also available for families are milestone calendars where parents can document milestones throughout the baby's stay. Please ask about the parent pathways and treasure life beads, as these are good tools to use for parents when speaking to your baby's nurse or remembering to complete tasks at various stages in your baby's NICU journey. It's okay to share your feelings with people you trust on your care team, including the bedside nurse or your social worker. Be assured that over time, parents do adjust to their baby being in the NICU. You will get to know your baby best and will be the most consistent caregiver for your baby. I hope this video has been helpful in bringing some light into the NICU experience and what to expect after your baby is born. Remember to ask the NICU care team questions, even if it means asking them the same question several times. Many families choose to keep a notepad or journal with them to write down notes and questions for the care team. It is hard to remember everything you are learning, especially when stressed, tired, and concerned for your baby. No question is a silly question. All of the NICU staff are here to help you and your family. Patient and family-centered care is proud to offer various forms of peer support to our Stollery inpatient families in both group settings and one-to-one at the bedside. These programs use fully trained volunteer families who have all had experience in the NICU with their own child and now come back to offer support to inpatient families. At our weekly family coffee hours, we have graduate families that join the social work team and inpatient families for informal conversation and light refreshments. Our one-to-one bedside peer support program is called the Family Mentor Program. Family mentors visit inpatient families at their bedside every 2 weeks and engage them by being a listening presence and having open, honest, judgment-free conversations that foster strength, empowerment, and hope in the inpatient family. You can ask your nurse or social worker if you'd like to have a visit from a family mentor.
Coping with the stressful moments in the NICU, we did that through leaning on each other, me and my partner, and leaning on family, and then also just having that trust in the doctors and the nurses, and that they knew what was best for our baby and that we would be okay. My most positive memory from the NICU was when we were in over Christmas time and my uncle came dressed as Santa Claus, and we just got to have that first kind of Christmas experience, and that was my favorite. Advice I would give to future NICU parents is that it's going to be a long journey, and it is a really difficult one, but the doctors and nurses are going to be honest with you, and they're going to support you, and they're going to get you through it, and hopefully you can get a little bit of trust in them, and just good luck, because 5 years down the road it feels really awesome. Lachlan is doing great now. We are in kindergarten. He's 5 years old. We're playing. He's enrolled in hockey. He does soccer, and he's got lots of friends.
So this is Hannah, and with how she's grown and progressed, she's doing amazing. She is 5 and she's in kindergarten. Hannah was diagnosed at 20 weeks with a giant omphalocele, which means the majority of her liver, intestines, and stomach were all born on the outside of her body, covered in a membrane sac. It's a fairly rare diagnosis, and hers was exceptionally rare because of its size. We needed a conservative approach, which ended at about a month when she needed surgery. And then she had a wound vac for 9 months to help close it. And then at 2.5, we got full muscle closure and full repair. So basically it was like closing a giant hernia, so she looked like a little pregnant 2-year-old. And now she has a beautiful tummy with a fantastic looking scar, and she's very unique with her no belly button.
Now that my baby is older and our family is doing well, I've become part of the NICU Family Advisory Care Team. Or you may hear us talk about the NICU FACT. This is a group of graduate parents, neonatologists, staff, and hospital leaders who work together to improve the care of our babies and the support of families while in the NICU. It is this group that helped create this video. We want you to know that we understand that this can be a very uncertain and emotional time, and that there are many people thinking of you and your baby. Please review this video as many times as you need and share it with others who will be supporting the care of you and your baby while in the hospital. Lean on the people around you, including your healthcare team, as they can be your strength and support if you let them. And welcome to the NICU.